Thanks everyone for your presentations. We have about 10 minutes for questions, 15 minutes for questions even. Well done everyone. And so we have a microphone and I am happy to bring it to you, or you can head over to the microphone stand. If there are first-time conference attendees or people from the BC Comma program who want to ask questions first, that would be fabulous. I'll bring it to you, Andrew. Is this, yeah, this is on.
So I'm not trained in any of these areas, so when I came to my first summit, it was the first time I heard social determinants of health. And probably the third or fourth time I came, there was a representative, a doctor actually down from Northern Health, and I asked the question, with all of these, 25, 27, I can't remember how many, why isn't there a geographic determinant for health, especially given the way our country is populated? And to me, that means that everybody in the province gets at least a small portion of health care according to their needs. And then on a per capita basis, regions like Vancouver get an embarrassment of riches because they have large populations. But we don't get that modicum of care. You know, I was supposed to go to see my doctor at the anal dysplasia clinic on Monday, but something came up on his life, so I'll actually have to make a second trip over here to Vancouver because the only place you can get access to the anal dysplasia clinic is in Vancouver, in fact. And it's information that we learned about at a health summit 10 years ago. It's always frustrating for me because I'm envious and jealous to be in a room where there are various iterations of health initiatives for men or Max Ottawa, because we don't have anything like that on Vancouver Island. And the Capital Regional District is approaching 400,000 people. I think the population on the island as a whole is approaching 1 million people. And how long are we going to have to wait to get a kind of men's health programming that is kind of pre-prevention for both infectious diseases, psychological diseases, and the burdens of loneliness and isolation? Now, I know there's at least one Island Health person here in the room, but I don't know if they're going to answer that question. Maybe somebody has thoughts on it.
Thanks, Andrew. If there are people on the panel who'd like to respond, that would be great. But for moving forward, if we can ask questions of folks on the panel as about the presentations, that would be absolutely great.
I guess, I mean, one thing that I'll just say, I think, is I'm not sure, some of the feedback we got is that I think we might need to think about a different population frame than just a men's health service in Victoria, and so I think it's important for us to think a little bit about what are the community politics and what are the like big P politics that are going on, and what are the ways in which we can try and find opportunities for that. But I'm going to be around Victoria for a while, so I'm happy to persist on that fight, and I know there's others here as well, so yeah, that's all I'll say.
Thanks, Andrew. Thank you, Nathan. Here's another question.
Thank you. In considering the boomer generation and knowing that the boomers have changed every facet of life through all of their life stages, I'm wondering if, thinking of the topic of the summit, queering healthcare access and accessibility, is what we know now or what we're researching now going to have to change to take this imminent, rather large population demographic into account?
Thanks.
I'll start briefly as the oldest person on the panel, since I'm closest to the boomers. I mean, I do think that that's partly why I think there's been a bit more work in Island Health than perhaps some other regions, is we do have a bit of an older population generally there. And I think there are a lot of unique challenges to thinking about what does it look like to age well. There's lots of conversations happening across Canada. I would point out again, Robert Savage, who's over in the corner here. Robert, if you want to give a little wave, who's done a ton of work around LGBTQ and aging. And yeah, I think there's a lot of different opportunities for us to think about doing more work in that area and making sure that we're engaging people from those generations and doing that work as well.
Thank you.
So one of the things that CBRC has been working on is a development of an intervention called Pivot, which originally started as totally outright for older people. And then so that we recognize that there is a need for program intervention and development for groups that are not young people. And that is something that we at CBRC are working on. But sometimes when we promote these programs, we may not specifically say that it's for older people, but just to keep in mind that the planning of it, everything has been has had mindfulness for that.
And I guess I'll just add from the Get Checked Online perspective, we've seen some regional differences in terms of people who are using it, and we see younger people are more likely to use it outside of Vancouver. So we're planning a lot of research looking more at a community level to get a sense of who, so we know who's using it, but we don't really have a sense of who isn't using it and why they can't use it. So more reflections and thinking about just the broader community, that's planned work that we're going to be doing.
Thank you. Any other questions?
Hi, I just had a question about Get Checked Online. Is there any plan in the future at all to move up north? Because I could really see that being a very valuable asset up there, because a lot of people up there have issues getting to the testing they need, and that could really help.
Yeah, thank you for that comment. It's definitely something that we hear and recognize and really want to address. And there's definitely work and conversation happening internally and with local partners, specifically like Northern Health. And I don't know exactly around the operations side what kind of plans or anything is happening, but it's definitely something that we realize is a gap, and needing to work, especially from the Get Checked Online model, needing that kind of intimate partnership with lab services and the costing efforts. It's something we're very conscious of, and definitely it's on our minds.
Hi, a question for Darren. With your work around the network, you mentioned, for example, people not thinking they have gay men in their community when you're out talking in other parts of the province, for example. Have you seen a shift over time in terms of receptiveness to the kinds of work around gay men's health across the province?
Sorry, I couldn't catch the first part.
So I was just referencing, you had mentioned in your talk that sometimes you would get faced with people who'd say there's no gay men in our community.
Oh.
So have you, I'm just curious if you've observed any shift in that over time, or if through your work you've been really able to engage people in a way that now they're at the table in a way they wouldn't have been before.
Yes, so I feel like I'm lucky in the sense that by the time it comes to me where I'm talking to someone, like say at the health authority level, that this is not the case, but I still work with a lot of frontline workers in northern and interior regions who experience it. So it's not something that I experience firsthand, but it's something that I hear from people that I work very close with still. I like to think that there is a lot of progress in this, but I feel like the people that I work with who are getting told this constantly would be a bit more pessimistic about it. So yeah, I'm not sure.
Thank you.
So coming from Alberta, I guess the first question is really just for Aidan around what was defined as outside of Vancouver, because for people who are from Alberta, I consider Vancouver to potentially be different. So I was curious about that, and more so in particular with Get Checked Online, the divide between perhaps that rural remote and that suburb and that kind of mid-zone between that urban. And if you, in any of the data or any of the conversations with the analysis, have seen a difference with that kind of suburban compared to maybe rural remote or fully other cities in that analysis, and if anyone else has thoughts on that as well.
Yeah, so that's definitely a conversation we've been having in terms of how to look at that more kind of urban, suburban, and rural distinctions. We've kind of done analyses more at a health authority level, kind of in those 3 different implementation regions that we have. But yeah, we're still working on it and thinking about like urban, but specifically, you know, thinking about what services are available, and then thinking about how does that affect suburban and possibly the services that may exist already in suburban regions. We know that people tend to commute long distances, or not very frequently, but there are a lot of people coming from outside of Vancouver to use Get Checked Online specifically. So it's not something that we've done specifically yet, but it's definitely something that we want to do in the future.
Suburban?
If you were specifically speaking to BC Comma, we do for our BC, we also go by health authority, and we include folks who are outside of Vancouver and what we call the Lower Mainland. About Alberta, though, our colleagues at CBRC are doing a very similar program that is called Repertoire, which I can connect you with the right people to find out more about.
Thank you, and we have time for one more question.
Sorry, one more question.
First-time attendees only.
There were lots of chances for people to talk. It's a question, Nate, for you. I was just curious. I've always wondered if that kind of like online map is something that could actually have like a legacy in sort of like becoming something that people continue to update and revise. And I wonder what your thoughts are around that.
Yeah, I think people like maps. I think there's lots. I mean, if folks don't know, there's a project called Querying the Map that's kind of a bit more arts-based maybe than specifically like health service oriented. I think for us what was interesting about the process is that we learned that we could populate a map with that, and that it's a bit of a starting place, but that just given who's at Pride and who then engages in the project, it's not going to be comprehensive. And so when I think about like the process that you folks went through in terms of check yourself and calling those different places, I think there's a lot of work to think about the inputs into a tool like that. But I do, and then I think the other piece that we've talked about as a team a little bit too is those are places that are identified as positive spaces for who that person is, right? And given how diverse our communities are, that might be a good place for a trans person of color. It might be a good place for a white gay man who's cis. Do you know what I mean? Like, but I think that there's a bit of difficulty sometimes in naming some places as safe for people, and so I think we need to do a little bit more thinking about how to do that per se, and that might be a little bit more about like connecting some of that information in so that it's a bit more rich than just like putting a place on a map. So I do think there's potential in it. I think people generally like the mapping process. Yeah. I don't know if that helps, and if other people want to do that, we're happy to connect and talk about that experience. I do think it's a really cool place, like cool way in which to, do some work that really, we got a lot of data really quickly and we're able to travel around a region and get a sense of where there was things and where there wasn't, and what are the current community conversations going on, so.
Awesome. Well, I know all of our panelists are lovely people who would love to talk to you more, so please follow up with them if you would like, and thank you all for questions and commenting.